Well, ladies and gentlemen, now let's come to the live case demonstration. What you see here is CT data preloaded into the A4 Clinic system, and if we're going to zoom in here, we nicely see the aneurysm. Now, in order to perform this type of analysis, we have to tell the system where the iliacs are, because that's where the segmentation starts. So I'm going to tell this is my first iliac artery, I'm going to tell this is the second, and then I can activate the pre-segmentation. So now a snake model will run slice by slice through my image data, and then if this step is finished, it provides my three-dimensional pre-segmentation, which pops up here in the 3D viewer. As the next, we're going to refine this information and start the balloon model to segment the luminous surface. The balloon model will then provide the fully three-dimensional segmentation. So that's the segmentation what you see here, and if we're going to go into our image data, you nicely see that this is already a highly accurate segmentation of the luminous surface. However, if you don't like that, you can manually interfere with this segmentation and push the balloon in the direction you want to see it. Now let's come to the much more complicated case, and the much more complicated case is segmenting the exterior surface. I activate also a balloon model here, which try then to segment the exterior surface. So this blue line here will start walking outwards until it segments the exterior surface. Since there is much less contrast in this image, I have to stop the algorithm if it's close to the target and start with the manual interaction. Manual interaction means I'm gonna specify controlled polygons on a few selective image slides where I see the contour, and that I can do on as many slides as I want. I do not have to go around all the circumference, so just the portions that deviate most, I'm gonna pull back or push the balloon into this direction with specifying a controlled polygon. If this is done, I reactivate the balloon model, and now it also considers this manual interaction and goes towards the exterior surface. Again, that step you have to do until the balloon model finally captures the exterior surface sufficiently, and after a few 1, 2, 3 run through, it's expected that this work step is finished. So that will take you a few minutes until you can provide then highly accurate segmentation. And after these manual corrections, you activate the balloon model again. And of course you can see the approach in both views at the same time. Now let's say that we are fine with this segmentation, and actually it looks already very fine, apart of a few minor corrections that should be done, and we can go to the next step. And the next step is that we now mesh the problem, meaning we cut down the wall and the thrombus into small regular pieces, because then we can just sum up over all these pieces to provide the volume. And what's meant by that is shown here. So if I cut away a small piece, then you see that the wall is now meshed with blue brick elements, and the thrombus is meshed with green brick elements. And having this meshed model available, we can extract the volumes, but we can also perform already now our biomechanical analysis. What I'm gonna do now, and for this biomechanical analysis, I have to tell where the aneurysm is fixed with its surrounding. That's down there in the bifurcation, and I also set this fixation up there at the renal arteries, and then I just click OK, and now the finite element analysis will compute the required wall tension for this specific morphology in order to carry the patient individual blood pressure. So that's the job of the finite element analysis. If this step is then finished, the tension of the wall will appear color-coded on top of my three-dimensional model, and that happens now. So now we see a color-coded map. In order to make this map a bit more appealing, I'm gonna change a bit the scaling. So let's say like that, and now you see nicely that we have an area of high stress which is down there, and typically in these high stress areas do also show signs of wall degeneration. And in this case, if I click here and just for a while switch off the finite element view in the image viewer, you nicely see that this large calcification here and here seen corresponds with this area of high stresses. But today we're not going to talk a lot about biomechanical analysis and the outcome of such analysis. We go further and extract the most important properties. And now I'm going to extract the most important properties between the aortic bifurcation and between the renal arteries. So between these two levels, indicated by these big pink lines here, I'm going to extract my most important parameters, including also the volume. If I'm going to say, okay, now all this information will be compiled into an analysis report, and this report pops up now. And now let's discuss this report for a few minutes. So at the first, it's going to summarize the input information. So that's the information that has been input into my system. And then the next block of information is, right now it tries to connect to the back system. I don't have a back system here, so I have to say no. And so this is the next block of output information, which are geometrical properties. And for today's presentation, the most important one is the total vessel volume, which in this case is 92 cubic centimeter between aortic bifurcation and the lower renal level. Since we already performed the fully biomechanical analysis, we also have biomechanical properties in our diagnosis report here. And the most important one is the peak wall rupture index, which in this case is 0.316. And what this means is nicely illustrated down there in our evaluation chart. So this is our evaluation chart. Remember, the thick solid line represents the average aneurysm patient, and now our individual case is almost on top of this line. That means it represents the average case very nice. As a consequence of that, the risk equivalent diameter is almost the same than the geometrical diameter, and the case should be treated like that. With that, I'd like to thank you for your attention and hope to welcome you soon again to another VASCOPS webinar. Thanks a lot.